Okay, just want to go through the knee capsule and the movement of the knee and trying to make sure that we're actually working the knee rotation and not the ankle or not the hip. So you want to isolate the hip so it's not working. You want to feel underneath, I call them the twangy little bits. And this is your hamstring. So when we want to move out, okay, it should be your lateral hamstring, and when we want to move in, you should feel that one pull. A little bit like some strings of puppeteer, if you think of that. So our foot is going to come along for the ride, okay, so the movement shouldn't initiate from the foot. You want the movement to initiate from your knee, and you'll be able to see it says tibialis and tuberosity. It says bony prominent at the top. That's where your focus. You can draw a mark, pop a sticker on it to help you see your movement. So if I'm wanting to rotate externally, I'm going to rotate, and I have to not start at the foot. I want you to really focus on thinking that knee's got to initiate that movement, that knee's initiating, that knee's initiating. And it could be a bit staccato like mine. And then you want to think of your medial hamstring trying to rotate it back in. Again, not leading with the foot, just to make sure. Might be that you just focus on your medial. I'm weaker on my medial on this side. You can see that I can't get much rotation. So something will be doing the work of that medial hamstring. I've had hamstring grafts for my cruciate ligaments, so my hamstrings are very weak. On this side, I can feel that my medial hamstring and semimembranosus struggles. And on this one, it's actually the lateral hamstring. So I'm struggling on both of them at the moment. So I'm better bringing this one in as we're bringing this one out. It's a little bit more of a struggle. It might be you just do a little movements and just working up to hold that movement with your knee in the external or internal rotation, just for 30%, having that isometric hold, working those hamstrings on one side then the other. And do one at a time, not both, just so that you're able to start to really focus. And if you see that foot moving forward first, it's easy to say, oh, I can do it, but it's my foot that's leading that motion. And it's so easy to do that, but I really want you to think it's coming from your knee, helping with that rotation. And this helps to stabilize your knee to make sure that those finer inch movements are working to help stabilize it. As you can see, I've got work to do, but yeah, just work up. It might be you're holding 30% and hold for 5 seconds, and then work it on up. From there, we can then introduce pushing further against our PLs and working up to that 100% max out or against a weight. Lots of things you can do to progress this, but let's initiate it from the right parts that we want and get the right muscles firing.